Hi, I'm Chris Heppel, Interim Fire Chief for Eugene Springfield Fire. Thank you for this opportunity to present the Springfield Fire and Life Safety Fiscal Year 22 budget, which is part of our entire Eugene Springfield Fire budget, as both departments are a merged organization since 2014. Since we're short on time today, I'd like to go ahead and get started right into that budget presentation. Eugene Springfield Fire covers not only the city of Springfield, but also the city of Eugene, as well as 7 contract districts, as well as engage with multiple mutual aid agreements with our neighbors surrounding us. Overall, we cover about 1,500 square miles. In the end, we cover about 287,000 citizens here in Lane County. In terms of the services we provide the traditional services such as fire suppression, emergency medical services, as well as fire marshal's office. And those are all supported through organizations through other divisions within our organization, such as training, logistics, as well as administration. We also manage 4 specialized teams. The first is aircraft rescue and firefighting out at our Station 12 at the Eugene Airport, as well as our water rescue crews who provide safety and rescue services for numerous miles of the McKenzie and Willamette River, as well as confined space, and then our regional hazmat team. Our regional hazmat team has even a greater number of square miles that they cover, up to and including portions of Central Oregon. In terms of the budget, Eugene Springfield Fire's total fiscal year budget is approximately $67,500,000. The Springfield Fire and Life Safety accounts for about 30.8 or about 31% of that total budget, or about $21 million. Let's drill down a little bit closer into those numbers. Let's take a look at the table to the left, and you'll see presented here is our fiscal year 20, fiscal year 21, and fiscal year 22 proposed budgets. Overall, personnel has remained relatively the same. Our materials and services has remained the same, but we've actually seen a slight decrease in that from the previous years. And then you see our capital outlay. You'll notice that fiscal year 21 was a pretty substantial year for capital outlay. The reason for that is because we made two significant purchases. One was the replacement of our self-contained breathing apparatus, which are the air bottle backpack with full face shield that we use for going into hazardous environments. And then we also purchased and replaced a fire engine that was about 23 years old. And so you'll notice our capital outlay drops off significantly this year because we've made those purchases. Overall, our line personnel levels remain unchanged from fiscal year 20 at 80 FTE. No service level reductions to Springfield are proposed in FY22. However, we do have one ambulance billing FTE reduction, and that team member elected to retirement after many years of service, and certainly appreciative for that. And so that gave us an opportunity to change up our billing with our external billing contracts, and that allowed us to reduce by 1 FTE there. In terms of breaking it down specifically, these pie graphs will represent that, with the first on the left being proposed resources, with the general funds providing about 50% of that $21 million. The ambulance transport fund brings in another large portion of that, and most of that revenue is garnered from transporting patients to hospitals. We have our levy, which helps with that, and that levy was approved again by the taxpayers in the November election, and certainly a lot of gratitude to the community to continue to support us there. And that was for 5 years, which will start on July 1st of 2021. I also mentioned that we have contract districts, so we provide those services under a contract, which generates some revenue for us, and then a small amount from permitting. If we look at our expenditure, not unlike any other fire department, is mostly in our personnel, followed by materials and services, directs and internal costs, as well as capital outlay, and then our dispatch contract, which is with Central Lane Communications to provide our 911 services, dispatching, and then call monitoring and communications during our emergency calls. Let's talk quickly about the ambulance transport fund. Here you'll see that there are 2 bars for each fiscal year. The bar on the left, or the green bar, denotes resources, and then the bar on the right, the more purplish or yellow colors, denote expenditures. Resources would include our ground emergency medical transport revenue, which is a federal reimbursement dollar for folks who are on Medicare and Medicaid. And then we also have our fire med revenue, which is our ambulance transport program, ambulance membership transport program. We also see some general fund dollars as well as beginning cash, which rolls over from the previous year, and then that ambulance revenue, which is again for transports. Our expenditures are certainly going to be our dispatching, capital outlay for things such as new ambulances, cardiac monitors, et cetera, central services expenditures, materials and services for everyday operations, as well as our personnel expenses. And then you'll see the beginning cash there as well. Let's jump down into the table data here, and you'll see we go from FY21, giving our forecast out to FY26. And you'll notice things are fine until we get to about FY23, where we'll end FY23 forecasted right now to be in a bit of a deficit, and then that deficit rolls over. So we're going to want to keep an eye on that piece, because if we don't do something to arrest that or correct that descent, that number just continues to perpetuate over the years. So we'll continue to monitor that and adjust for that going into the future. In terms of call volume and services we provide, so up to our call volume through February of this year, so we're about 2/3 of the way through, a little bit more. We saw almost 27,000 calls for service, where about 6,800 of those were or occurred in the city of Springfield. Overall, so far this year, we've seen about a 3.7% reduction in total call volume. And then here you can see a breakdown of where those calls are going. As traditionally seen, about 85% of our call volume is emergency medical services calls or calls for EMS. Our response reliability we like to track. So response reliability is where your neighborhood fire engine or ambulance is available at the time that you call 911. So let me give you an example. If you live in the Thurston neighborhood and you were to call 911, is the fire engine at the Thurston station available to respond to your call? And our goal is, the answer to that is yes, at least 85% of the time. So we've actually saw an increase in response reliability. Last year I reported we were just below at 84.3. This year we're at 88.1%, which is actually about a 2.3% increase in response reliability. The other piece is trying to minimize loss due to fire. And so what we do that is, are we containing our fires to the room of origin? And in this particular case, at about 82% in Springfield, which is about 8% above the national average. And we've actually seen an increase in this of 14.4% since fiscal year 21. So we're trending in the right direction with regards to that. FY21 has been a significantly busy year, and we've had a tremendous amount of accomplishments, certainly with COVID. We had crew members who worked in the emergency operations centers, not only in Eugene and Springfield, but also with Lane County. We used our CARES funding to secure personal protective equipment and acquire decontamination equipment, not only for the safety of our crews, but also the community members. We're also aiding in the vaccination rollout and administration, and we have crews that are working 3 to 4 days a week in coordination with Lane County Public Health to accomplish that. We completed our self-contained breathing apparatus or SCBA replacement. Our current academy is training in these, and we'll have full rollout of this product by April or May of this year. Conflagrations, so when fires get too big and overwhelm local resources, they call in additional ones. So we deployed to 8 separate wildfire responses this year, and we received $352,000 in reimbursement for those responses from the Office of State Fire Marshal. We saw about $336,000 in revenue from our ground emergency medical transport piece, which I talked about during the ATF, and we look forward to that hopefully going up into the future. We purchased a new engine and ambulance, and we expect those to be received later this year. We did a tremendous amount of work around technology upgrades. We went from older Panasonic Toughbooks to iPads, so a much more much more reliable and cost-effective product. We finished the upgrade of our mobile data computers and all the engines. We implemented a new training platform for all of our crews so they can actually do training more remotely versus coming to a centralized location. We upgraded our records management software as well as our electronic patient care reporting. And we also were able to move much of our data and information off of traditional servers located in Springfield to a more secure cloud environment. We moved forward with purchasing and managing our own pharmaceutical inventory, which gives us more control over that. And we also completed a standards of cover. A standards of cover tells our community what we can do and what we can't do in our performance metrics. And those are, that is a very good document. Along with, we completed a risk assessment of our entire area, and both of those documents, again, tremendous amount of information, are available on our website. FY22 is going to continue to be a busy year. So we have this huge to-do list. We've got the Olympic trials that are coming. Again, they moved to the right along with the World Games due to the pandemic. We're doing Hilltop radio system evaluation. We're doing, and then we're looking at a grant, which we've already submitted for, a regional grant with the Lane Fire Defense Board to help fund that. We're looking at doing in-apparatus and handheld radio replacements. Our radios are 10 to 13 years old. They're supposed to be replaced every 10 years. So this is one, a communications issue, but also a firefighter safety concern that we'll want to address. We're also looking to align our 2019 code permit and inspection fees. We'll roll out the new engine and ambulance. We're also implementing right now an inventory control system, new inventory control system in our logistics division, but we won't see that fully implemented until next year. We're continuing with our cost reduction for COVID-19, and I look forward to the establishment of the Joint Jurisdictional Advisory Committee on our merger. So this is where elected officials from both Eugene and Springfield will come together, and we'll talk about the future of the fire department. And then we'll top that off with, we're currently in a fire chief recruitment process and look to have that closed out by June with the new fire chief coming early next fiscal year. Looking beyond fiscal year 22, more like 23 to 26, we've got the World Games coming in August of 22. There's always looking at our call volume with regards to population growth and our associated aging population. We're going to continue to monitor those ambulance fund reserves, as I showed in the about 2 years we'll be in that deficit component. We're looking at alternative service delivery models. We started that type of program actually in 2016 with the implementation of our basic life support ambulance program, and we actually added one of those units to Springfield 2 years ago out of our Gateway station. We need to update and increase the footprint of our fire marshal office. We're starting to get more and more infrastructure and buildings which require plans reviews as well as inspections and as well as code compliance, which needs to be managed. Looking at future growth planning in terms of acquisition and station placement is certainly always on our horizon, as well as a number of our stations are becoming quite dated. So we need to be looking at some station remodels. While we may not replace the whole station, then at least look at updating and upgrading those particular facilities. And then we're always looking at our fire department's governance model. So we are a merged department with Eugene as well as Springfield, and we want to continue to move that in the right direction. With that, thank you for this opportunity to present the Springfield Fire and Life Safety Budget for fiscal year 22.